The Earth's population has reached 7,300,000,000 people. 9,500,000 people live in the Republic of Belarus. The Grodno region has 1,070,000 inhabitants. About 4,000 people are born in Grodno Regional Clinical Perinatal Center annually. The history of Grodno Regional Clinical Perinatal Center started in 1945, when a city maternity hospital appeared. At the beginning of the 60s, the maternity hospital moved to a new multi-story building. On the 7th of September 2007, there was an opening ceremony of Grodno Regional Clinical Perinatal Center after reconstruction and major repairs. In 2011, we introduced a quality management system. The same year, the center received an award of Grodno Oblast Executive Committee for achievements in quality. In 2013, Grodno Regional Clinical Perinatal Center won the Republican Quality Contest The Best Goods of the Republic of Belarus in the category Public Services. The staff of Grodno Regional Clinical Perinatal Center are highly qualified specialists. More than 45% of doctors and 80% of nursing staff have qualification categories. The perinatal center includes inpatient departments and a polyclinic. The polyclinic has 2 departments. The Diagnostic and Consulting Department Marriage and Family provides assistance to patients on issues related to gynecological endocrinology, female and male infertility, and miscarriage prevention. The Department of Medical and Genetic Consulting uses methods of invasive diagnosis of congenital pathology, which help to reveal chromosomal fetus pathology. All this leads to decrease of infant mortality and invalidity from chromosome and genetic diseases. The inpatient department consists of 212 places. It occupies 2 buildings, which allows to separate observational and physiological patients. The reception ward is equipped with all modern appliances and instrumentation for diagnosis and emergency aid provision for arriving patients. The Department for Pregnancy Failure and the Observational Department for Pregnancy Failure are meant for delivery of care to pregnant women with high level of perinatal risk of pregnancy and labor complications, as well as to the patients with gynecological disorders. The lying-in department is represented by 2 labor units, physiological and observational. Labor wards are properly equipped for partner births with home conditions for both an obstetric patient and her family members. The department has 3 operation theaters for elective gynecological operations, as well as for elective and immediate obstetrical operations. The physiological obstetric and observational obstetric departments are designed for provision of high-quality care to obstetric patients and newborns in the puerperal period. We have created comfortable conditions for rooming in. Particular attention is paid to teaching newborn care and breastfeeding to women. In the department for newborns, our little patients receive high-quality care and necessary medical assistance. The Infant Resuscitation and Intensive Care Unit treats premature newborns with infant respiratory distress syndrome, low and extremely low body weight, and congenital malformations. The department is fully equipped with highly effective medications and devices for developmental care. The X-ray Diagnostics Department is equipped with modern ultrasonic systems that allow diagnosing obstetrical pathology and congenital malformations in fetus and newborns. The Clinical and Diagnostic Laboratory is equipped with a complex of modern laboratory instruments. Patients can undergo a complete medical examination at one health institution, and doctors can receive full information about health condition of their patients. Grodno Regional Clinical Perinatal Center is a training facility of Grodno State Medical University and Grodno State Medical College. There, medical workers-to-be can implement their theoretical knowledge in practice. Grodno Regional Clinical Perinatal Center provides a wide range of medical services to both citizens of the Republic of Belarus and citizens of other countries. Grodno Regional Clinical Perinatal Center is an obstetrical health institution of the regional level of perinatal care, which provides high-quality outpatient and hospital care to families, pregnant women, women in labor, new mothers, newborns, and patients with gynecological disorders. In 70 years' time, more than 240,000 people who inhabit the world were given birth at Grodno Regional Clinical Perinatal Center.